this is a bit of a complicated and maybe even a little bit of a contentious subject. So, CDC says that if you're vaccinated, you don't have to wear a mask indoors, outdoors, or virtually anywhere, and social distancing isn't really required anymore. So, first thoughts, I'm sure from everyone, is Yahoo, this is great. But I'm afraid that it's kind of important to read between the lines a little bit and look at the fine print about this. And let me elaborate. First of all, while you look at the media right now, it kind of implies that the pandemic's over, we're done, and it's not. There's still roughly 50 cases that we know about in Forsyth County every day. There's still deaths and there's still hospitalizations. In fact, our hospitalizations number of admissions due to COVID today hasn't really budged in the last 6 weeks. So COVID still exists, but the epidemiology is going to change. We've been looking at these big waves that hit and move through a population and affect everyone, pretty equally, sometimes some socioeconomic or racial differences, but everyone is affected. What's going to happen as time goes on, the virus is going to take advantage of unvaccinated populations of people. So rather than having big waves move through an entire community, we're going to have pockets of infection that occur in unvaccinated groups. This could be in a workplace, this could be in a school, could be in a social circle, it could be from a spreader event in a place of worship or in a drinking or eating establishment. But it's going to take advantage of unvaccinated people. So why is that important? Is that even though I agree with the CDC and the science that vaccinated people are largely protected from getting infected, not 100%, but largely, and that transmission from vaccinated people is an unusual event. The problem is that not everyone's vaccinated. Here in Forsyth County, for instance, we're roughly at about 50% who've been partially or fully vaccinated. So that means, take for an example, that you walk in to a retail store and there's 100 people in that retail store. Just doing the math, 50% of those 50 are not vaccinated. Same thing in a place of worship, same thing in a gymnasium, same thing in a restaurant. Now, that's maybe okay if you are there and you're vaccinated and you think, well, I feel protected enough by my vaccine. But the people around you don't know who's been vaccinated and who's not. Take, for instance, you have a store clerk, who's checking people out, and they have somebody at home who's immunocompromised. They've been taking special precautions because they don't want to get COVID, and they especially don't want their loved one to get it from them. They've been wearing their mask, they've been going to work, and their anxiety level is a lot less because everyone around them is also masked. Remember, the primary reason we wear the mask is to protect other people. Yes, it helps you, the individual, the mask wearer, as well, because there's some protection there, but it's to protect other people. So the store worker looks around now at all these unmasked people. Who's vaccinated? Who's not? I don't know. I feel unsafe. Another situation, let's say you've been a school, you're a teacher in a school, and as a teacher, you've been vaccinated, but you're an elementary school teacher. None of your kids have been vaccinated yet. We've just started the 12 to 15-year-old group, but you feel safe because they're vaccinated and everyone's distancing a little bit, and experience has been in that situation that transmission in schools is an unusual event. But if we start taking down the masks, then that population of people is going to have transmission with it. Also, let's think about the kids a little bit. Let's take a 14-year-old. Some 14-year-olds will be vaccinated and some won't. The CDC says if you're vaccinated, you don't have to wear a mask. So are the kids who are not vaccinated going to wear a mask and feel apart, feel separate, feel like they're being discriminated against? It's just something to think about. There are also populations where, masking is still really necessary. Hospitals and healthcare areas. We have a lot of immunocompromised people. We need to protect them. We need to protect our patients. We need to protect our healthcare workers. Masking is still paramount there, and the CDC says we should still be doing it in that situation. Other big congregate settings also, dormitories in schools, for instance, at a university or a prison or a nursing home where people live close together. Masking is still going to be really important. So, I really want people to understand this as we move forward, as we start to relax and try to get back to normal, is that not everyone is in the same boat, and that we need to be respectful, and that we need to be polite. So, if a workplace, for instance, decides that in order to make their workers and their people feel less anxious and safer in that environment, and for those people who can't be vaccinated in that environment, to protect them, that they're going to continue to want a mask. And they're going to continue to ask people to mask when entering their facility. Be respectful of that. Be respectful. This is for the people who've been out there slogging away throughout the pandemic to take care of us. For schools, be respectful of the school. If they want to continue to be able to have in-person classes and not to have to quarantine half of their students and not to have to cohort and to be able to allow after-school activities, to be able to let the kids ride a bus safely, we need to be respectful. They may still want to be masked, and actually, I would recommend that schools continue to mask when inside. Now, outside, I'm fine with taking the mask off. I have been all along, and I think it's fine to do that now. But inside, in these particular situations, we need to be thoughtful and respectful that there are going to be places that are going to continue to need to mask or want a mask, particularly in areas where transmission is more likely. Healthcare facilities. So, for instance, here at Wake Forest Baptist Health, for our entire health system, we're going to continue to require masking for entry into our facilities, both inpatient and outpatient, as well as entry into the workplace. And the reason we need to do this is, one, it's still guidance from the CDC. Two, is out of respect for our patients and for our healthcare workers. And three, because we have immunocompromised people and vulnerable people in our facility. And out of a need for patient safety and to protect the people around us, we like to have the additional protection that masking offers, because not everyone's vaccinated. Now, moving into the future, as we get closer to fall and our vaccination numbers keep going up and our case numbers are looking great, we can look at further relaxing our masking recommendations, both in our facility as well as in other areas. But I think moving forward here in the next week or two, you're going to see other workplaces make their own decisions on what to do about masking within their confines of their business. And we need to be respectful for their employees and their people in their decision if they're still asking for masking to take place. And I support indoor masking when you have mixed populations of unvaccinated and vaccinated people. Until we hit that magic number of herd immunity or close to it, the unvaccinated cohort are vulnerable, and we need to help protect them. Masking is the way to do it, and the best way to do it. With that, I'll open it up with questions.
Two questions for you. One, you talked about your feelings of the masks and indoors and the, discrimination, if you will, some with and without masks. Do you think we should just lift the mask mandate for everyone, vaccinated or not? Would that make it easier since we don't know who's vaccinated and who's not?
That's a great question. Yeah, it'll make it easier, but it won't make it safer. Because the unvaccinated people can have COVID. Again, there's 50 to 60 cases a day here in Forsyth County. Those are the ones we know about, and 30% of those people are asymptomatic. So it really needs to be an all or one thing, and the safest thing is to have masking for everyone until we as a society can take the masks off together. And I know that isn't entirely along the lines of, having individuals make their own decisions about their risks themselves, and that someone might say, you know what, I'm okay with the risk. I don't think I need to wear the mask. But the problem is that you're also making decisions for all of the people around you, and they may feel differently because you can give COVID to them, particularly if you've been unvaccinated and you're unmasked.
Just a follow up, I mean, this is all based on the science according to the CDC. Science is always changing. So they made these guidelines yesterday. The science changes in 2 weeks, 3 weeks. Is then it going to be everybody has to wear their mask again?
It could happen. Or it may be that things might be adjusted so that you can make your own decisions about unmasking and masking in your own households, within your own families, groups of friends, and things along this lines. But in public areas, masking still might be the guidance. That could happen. I think the summer is going to be pretty good. Our case numbers are going down. I don't see a lot of danger signals on the horizons, except in some areas. And those are the areas where we have large groups of unvaccinated people getting together in close situations. So summer camps, either sleepaway or day camps, those are places you're still going to want a mask because you're going to have unvaccinated and vaccinated people. And if you get an outbreak of COVID in your summer camp, you're done. You're done for the summer. There goes your mission. There's a lot of disappointed kids. But the one place where we could see masking come back in a lot stronger way again would be as we get into the winter. I think there's going to be some seasonality that it starts to occur with coronavirus, just like our other respiratory viruses. So we'll have to see at that point. But right now, I think for those groups who really want to have a safe, happy, COVID-free summer, and you got lots of people getting together, particularly people who have unvaccinated kids and those groups, you want to stay masked. It'll make it a lot easier to get through the activities you want to do.
I have a question about the vaccine and the effectiveness. Is there any new information on that and kind of the future of booster shots? And if not, wouldn't it seem safer that until we have more information, we continue to mask?
So yeah, Victoria, the booster shot thing, I think that's one of the number one questions I get now. So we know how long immunity from the vaccine lasts, only as long as we've been using it. So we started doing the clinical trials in June of last summer, so we have 9 months of data. So far so good. Immunity looks pretty robust. Most of us are predicting that at some point we'll need a booster shot, and that could come as early as late fall, sometime into that area. One of the advantages of a booster is we can adjust the vaccine to cover variants, because the variants are still a little bit of an unknown as to how they might affect us in the future. My personal feeling is that masking adds an extra layer of safety on top of vaccines. And the analogy I've used is that it's like the virus is on a mud run. And if you vaccinate, you make the mud thicker. And if you wear the masks, you make the mud deeper, which makes it harder for the virus to get to the finish line, making a transmission from one person to another. So they work synergistically. And so for certain situations, particularly when vaccinated and unvaccinated people are getting together in public areas where there's a good number of people, I think masking still makes sense. And I'll tell you, out of respect to our workers and out of respect to the people who've been out there for us over the pandemic, I'm going to continue to wear my mask when I go into public areas, even though I've been vaccinated.
You mentioned earlier that there's a portrayal that the pandemic is over, but when does a pandemic end? What would the metrics need to look like for it to be declared, quote unquote, over?
Yeah, that's a good question. So you're not going to wake up one day and see a headline and fireworks saying pandemic over. Um, what's going to happen? The pandemic's just going to fade into a background of coronavirus infections that initially will be occurring in pockets of people in unvaccinated situations. So you might have an outbreak in a certain, associated with a place of worship, just as an example, in the unvaccinated people there. And those outbreaks will become fewer. The numbers involved in those outbreaks will become smaller. And then the virus will eventually just fade into the background, just like our other respiratory viruses, influenza, adenovirus, paraflu, a lot of names of viruses you've probably never heard of before. But I think that's eventually what it's going to be. So the point where it ceases to be an epidemic or a pandemic and becomes endemic, which means just something present, is going to depend how you define it. But I think we won't declare the pandemic totally over until we've gotten through the winter season and until there's some better outlooks across the world, because right now, as you guys all know, there's a lot of infections happening, particularly in Asia and Southeast Asia. And as long as that's occurring, other countries still will remain at risk for having viral introduction into their population.
Dr. Ohl, I know you kind of answered this, but yes or no, are we doing away with masks too soon?
Lori, I don't think it's a matter of being too soon. I think it's a matter of that people need to be smart about how they do it and need to be respectful, of the entire community and the entire population. So what the CDC said is technically correct. Vaccinated people are largely protected from getting infected and don't infect others, and so the mask isn't as important to them. The problem is I don't think the CDC thought a little bit about all of the human behavior that goes with that. And what I'm concerned about is the unvaccinated groups of people saying, it's good enough for them, it's good enough for me, I'm getting rid of the mask. And so in that aspect, I think we are getting rid of the mask too soon.
Yeah, because I know a lot of the health experts, yourself included, said the mask would be one of the last things we would see to go.
Yeah, it should have been one of the last things we see to go. I'm much more comfortable with the social distancing going away than I am with the masking going away.